Hello cruel world, I'm your host for A Psych for Sore Minds. My name is Dr. Sohom and I'm a consultant forensic psychiatrist. I live and work in London. So what is a psychopath? Are all mass murderers psychopaths? Why do psychopaths do so well in the corporate world? What's it like to work for a psychopath? And is Michael Jordan a psychopath? These are all questions that I'll be exploring in the next few episodes of A Psych for Sore Minds. Are you interested in true crime or perhaps mental illness? Well, why not both? Welcome to A Psych for Sore Minds, the only YouTube channel that I'm aware of that addresses the intersect of the two. I'm your host, Dr. Sohom. As I said before, I'm a consultant forensic psychiatrist. I live and work in London, and I assess and rehabilitate mentally disordered offenders so you don't have to. I work in prisons and in courts and in secure psychiatric units that are reserved for the most dangerous patients. And on top of all that, I act as an expert witness to assist judges during criminal trials across the UK. So this channel dissects a whole range of mental health topics, some related to offending and violence, and some not, some more kind of familiar to the average person. So the inspiration for this particular video was this. I was recently a guest on a podcast called White House Farm, and the host asked me a very sensible and reasonable question, which is, are all mass murderers psychopaths? So I'll address that later on in this episode, but spoiler alert, the answer is no. But it got me thinking about my work, looking back at times that I've rehabilitated and formally diagnosed clinical psychopaths, because that's part of forensic psychiatry. So in this episode, I'm going to talk about the clinical definition of a psychopath, which might surprise you is slightly different from the colloquial term psychopath. And I'll also tell you why psychopaths thrive in the corporate world. And also I'll answer that question, why some mass murderers don't necessarily fit the description of a psychopath. And then I've got a follow-up episode where I'm going to talk about one particular patient of mine that really kind of stuck in my mind, who was a clinical psychopath. And he stuck in my mind because he managed to pull the wool over my eyes and everybody else that was treating him, with a fairly shocking conclusion. And next episode, I'm also going to talk about my personal experience of working with a psychopath. I'm talking about my ex-boss. Of course, the person I'm talking about was never formally clinically diagnosed with psychopathy, but I'm fairly confident that he was one. And if you listen to me describe the way that he worked, how he treated his other colleagues, and also just the way that he made us all feel, then I think you'll agree with me. So welcome to A Psych for Sore Minds. So let's start with the basics. What is a psychopath? Well, about 1% of the general population is a psychopath. It can be as high as 25% of male prisoners. Obviously, that depends on the different studies, the different tests, and also which prison you go to. It might surprise you to know that psychopathy is actually a formal clinical diagnosis. So it's not in, for example, ICD-10, which is the classification system that we often use in England. But it is something that's specifically diagnosed by those working with mentally disordered offenders, such as forensic psychiatrists like yours truly. And it's usually diagnosed using the PCLR, which is the Psychopathy Checklist revised. It's a tool developed in the 1970s by Dr. Robert Hare, who's a Canadian professor and renowned criminal psychologist. So within the PCLR, there are 20 individual criteria, and the subject is scored either 0, 1 or 2, depending on the absence, partial presence or inconclusive, or fully presence of the particular criteria. Now, I'm not going to name all 20 features for you now because it might get a bit dull, but in a future video, I plan to actually use the PCLR on real life people, including Michael Jordan. There's a reason that I've chosen him, as well as maybe some fictional characters, so look out for those episodes. So I'm going to highlight for you now the key ones that I think particularly distinguish psychopathy as a diagnosis. In the interest of balance, I should say that in my opinion, some of the 20 features are not particularly indicative of this disorder, or they're a repeat or very similar to a previous factor, which obviously can skew the result. So to give you a quick example, early behavioural problems is one of the features in the psychopathy checklist, and so is juvenile delinquency. And I get that not all early behavioural problems are juvenile delinquency, but I think that there's such a big kind of overlap that it invalidates the need for both factors. That's just my opinion. I'm not trying to start beef with Dr. Hare. He did 3 decades of research into studying psychopaths, including prison inmates in Vancouver. I've assessed and treated a handful of psychopaths, but I've not researched them as a group as a whole. As is often the case with mental health issues, the general public misuses the phrase psychopath. Shame on you. I think when the average person talks about psychopath, they mean it to be somebody who is a bit unhinged or aggressive or like violent or short-tempered. And as I'm about to discuss, that's actually incorrect. The vast majority of people who are very violent are technically not clinical psychopaths. And also psychopaths can often thrive without violence. And as to being unhinged, from my experience, as I'll outline in my next episode when I talk about a previous patient, psychopaths can actually be the opposite of that. They can be cold, they can be calm, they can be calculated, they can be the opposite of unhinged, hinged. They can also display equanimity even when committing violence. Equanimity, I love saying that word. I recommend at least 5 portions of saying equanimity every day. And if you don't know what equanimity means, go look in a dictionary. Okay, so here are the most important of the 20 factors from the psychopathy checklist, in my opinion. Psychopaths have superficial charm, so they need this charm to manipulate people. Also, they fail to learn from their experiences. So if you punish a psychopath, they might show humility, but a true psychopath never changes his spots. Psychopaths also have egocentricity, which is basically the whole world revolves around them. They only look out for number one. And they also have the incapacity to feel guilt for anything, and they're incapable to feel love or empathy for anybody. And I really can't stress that enough. It has to be for anybody. And in my mind, that's one of the key features that distinguishes a psychopath from just a normal violent offenders. So a non-psychopath can kill because of a particular belief or cause, but they can still show empathy for other people, such as their community in general or their family members. So these people are not clinical psychopaths. That's not to say that their actions aren't any less morally wrong, but I'm just saying they wouldn't fit the diagnosis of psychopathy. Psychopaths are pathological liars, and they're impulsive, and they're very grandiose. One way that I conceptualize it, and I'd invite you, dear viewers, to do the same, is this. Psychopathy is more about manipulation than it is about actual violence. It just happens to be that for some people, in some circumstances, violence is like an easy way to intimidate and to manipulate somebody. So a true psychopath will see everybody, even people that are close friends or family, as somebody who's an opportunity to take advantage of and to benefit from other people. And I say close friends and family, I use the word close loosely, because you could argue that despite physical proximity, psychopaths are never actually emotionally close to anybody. So a true psychopath cannot feel love and cannot even really be in love, although they might fool themselves into thinking that they can. However, somebody with antisocial personality disorder, for example, is not necessarily like this. I've talked about antisocial personality disorder in a previous episode. Go check it out. So they might have a lot of the same tendencies as a psychopath, such as impulsivity and aggression, but that could be due to their circumstances. So some people with antisocial personality disorder might condone violence and use violence, but they still potentially have the capacity to love other people like close family members. For some reason, when I was writing this, the character Jamie from Top Boy really personified this. So he's an example of somebody that might have an antisocial personality disorder, or definitely an antisocial lifestyle due to his circumstances, and he's a drug dealer. But he's clearly not a psychopath because he shows genuine love and concern and affection towards his family members, such as his 2 younger brothers. In fact, I'd go as far as to say that most of the main characters in Top Boy show some form of empathy or loyalty towards other people. And the other thing I wanted to say, and this is from my kind of personal observations, it's not a formal diagnostic feature, is that, and it's not on the psychopathy checklist, is that psychopaths tend to be loners to a degree. So I've worked with several psychopaths in locked, secure psychiatric units and also in prison. And as I keep saying, I'll tell you about a patient of mine next episode who's stuck in my mind. But the one thing I noticed is that they might have a superficial charm, and they're generally relatively well liked and popular. And there is a hierarchy within the psychiatric units, just like there is in prison. And psychopaths definitely tend not to be at the bottom of the hierarchy. But interestingly, they don't crave particularly reassurance or praise, for example, as much as some other antisocial or immature peers on the wards or in prisons might do. They don't need to be the centre of attention, or they don't need to rely too much on their own status. And I think that's because they only care about what others think about them to a degree. And even though they do have associates and peers that they hang out with, and even though they might be generally popular, from my observations, they're not emotionally connected or close to anybody. So, for example, a psychopath would very easily swap over their friends if it is to their advantage, or a psychopath might disassociate themselves from a particular peer. So say if a previous friend was caught smuggling drugs into a psychiatric ward and the staff caught them and they were keeping a very close eye on that particular person, or if a previous friend of a psychopath had a fight with another alpha prisoner and then became a target, then a typical psychopath might have been friends with that person for months or even years, but it would drop them in a second. So basically what I'm saying is that psychopaths don't have their homies back. So why do psychopaths thrive in the corporate world? This is quite a popular and recognised theme, especially within the last decade or so, and it's been brought to the forefront of people's consciousness by the Jon Ronson book called The Psychopath Test. And I think it's because the corporate world is obviously quite cutthroat, but a psychopath will do absolutely anything and screw over absolutely anybody to get to the top of the ladder. They'll have no real remorse, they'll have no loyalty, although possibly they might fake this to a degree because they might not even know that they're a psychopath. So I think whereas the average corporate person might be quite ruthless, they will have boundaries. They'll draw like a line in the sand. For example, they probably wouldn't screw over a colleague who's been close to them, who's been like a close mate, whereas a psychopath would do that in a heartbeat and would sleep like a baby then. So it's not that dissimilar to the situation I was talking about before, about where a psychopath has dropped friends in prison or in psychiatric unit without any qualm. So I thought it'd be interesting to think about how I would act if I was a psychopath. So as you know, I'm a fledgling YouTuber and I'm making these YouTube videos about mental illness. Some of my videos are connected to violence and are about the world of forensic psychiatry in general. So if I was a psychopath, I might intentionally make some false or like controversial statements that I didn't actually believe, such as implying that all mentally ill people are dangerous, which they absolutely are not. I mean, I just work with mentally disordered offenders, so the group that I assess the most and the groups that I treat, and many of my cases for a Psych for Sore Minds are actually like that. To give you another example, if you've been watching my channel, you know that some of my episodes I interview other guests who have had experiences of serious mental illness. So if I was a psychopath, I might intentionally try and find and bring on somebody who is currently acutely quite unwell, and then I would ask them sensitive questions just to get a response. So say if I wanted to be really clickbaity to increase my views. Is clickbaity a word? Clickbaitorial? Clickbaitish? Anyway. But what I'm saying is I would see everything and everybody as an opportunity for manipulation for my own success without having any kind of respect or thoughts about their well-being. But don't worry, I'm not going to do that. I'm not a psychopath, although I definitely do have some of the traits. So my next question is this: are all mass murderers psychopaths? So as I said, I was recently on a podcast called White House Farm, and the host asked me this, whether all mass murderers have to be psychopaths. So this was specifically in the context of me giving my professional opinions on the case of Jeremy Bamber, who murdered his own parents, his sister, who had paranoid schizophrenia, and his sister's 2 children. And he did all of this for his own financial benefit and then tried to blame it on the sister because she had paranoid schizophrenia. So that episode of that particular podcast won't be out for a while, I think January, but I'll reach out to you guys to let you know. It's a fascinating case, and in fact, I might even cover it one day myself in a future episode of A Psych for Sore Minds. So let's answer that question. Do all mass murderers have to be psychopaths? In my career, I think I've I've assessed maybe 3 people who have committed multiple murders, and I don't really like to use the term mass murderer, but I get asked about them all the time. So yes, there can be other explanations outside of psychopathy for why somebody would commit multiple murders. So mental illness is a very clear example. This is obviously my area of expertise. So a good example of this would be Anders Breivik, who I'm sure you've heard of if you're interested in true crime. He's a Norwegian man who killed 8 people by detonating a bomb in a van in Oslo and then shot dead 69 participants in a rally in Norway in July 2011. And he was formally diagnosed by forensic psychiatrists that were appointed by the court with paranoid schizophrenia. And his reported delusions included beliefs that he was a knight and that he was a grand master of a secret Templar organization. And although the defense psychiatrist stated that he had a personality disorder. So just to be clear, I'm in no way commenting on the moral aspects of what Breivik did, but rather the thought processes behind his intentions and what kind of drove his ideology. Another issue which I touched on before is that some terrorists could have a religious ideology, and although they might commit violent atrocities, it's not done out of manipulation or narcissism. It is done out of hatred, but it's done out of their admittedly very warped ideology. In other words, a terrorist can hate one particular group of people and could even kill them. However, they could still show love and affection and warmth towards like their own community or their wider family. So basically, they believe in their heads that they're doing it for a higher purpose. Whereas a true real-life psychopath wouldn't care about any other higher purpose. There is no higher purpose apart from themselves. So that is it for this episode, viewers. In my next episode, I'm going to continue with the theme of psychopaths, and I'm going to talk about a patient of mine who managed to pull the wool over my eyes and the eyes of the treating team with a shocking conclusion. And I'm also going to talk to you about my experience of working with a psychopath, i.e. my ex-boss. And then at some point, I'm going to do a further video about Michael Jordan and whether he is a psychopath or not. So please subscribe to our channel on YouTube, and I would love some more comments. We're getting decent views, but there's not as much generation of discussion as I would like. And if you're able to put down some of your thoughts, then I'm very keen to respond to you, answer your questions, just have a bit of a chat basically about mental health issues. So please subscribe. Not only does it help me out immeasurably, but it will bring you an overwhelming calmness and tranquility. I guarantee it. So follow us on Instagram, like our Facebook page, submit an episode idea or any questions. And you can do that via our email address, which is psych4soreminds@gmail.com. And if you're referencing us, then please use the hashtag PsychSore. And also tell your favorite people about a Psych for Sore Minds. They deserve it. Spread the love. Until next time, stay thymic, homies.